All right. Good afternoon, everyone, and thank you for joining us for the COVID-19 Facts versus Fiction webinar. My name is Dr. Tamika Duplessis, and I will be the moderator for today's session. Joining me today is an esteemed panel of experts that I am extremely excited to have with us and members of the Student Affairs staff that have made significant contributions to making today possible. But first, let me introduce our panelists. Our first panelist is Dr. Rebecca Harris-Smith. Dr. Harris-Smith serves as a healthcare coordinator for Delgado Community College and advises the college on all things COVID-19. She is from New Orleans and completed the PN program while still in high school. Dr. Harris-Smith received a Bachelor of Arts in Education from Gillard University, an Associate of Science in Nursing from LSU Health Sciences Center, and later received a Master's of Nursing from the University of Phoenix. She also received a Doctorate of Education in Higher Education Leadership from Nova Southeastern University in Fort Lauderdale, Florida. Rebecca has been a nurse for 48 years, working in multiple areas across healthcare. Dr. Harris-Smith has an extensive resume from her time here at Delgado. Over a span of 11 years, she served as an instructor at Charity School of Nursing in Maternal Child Health, program director for the Practical Nursing Program, and provided oversight management for the CNA program. Rebecca retired from South Louisiana Community College as Dean of Nursing and Allied Health. She maintains active memberships in several professional organizations that span education all the way to nursing. Please welcome Dr. Rebecca Harris-Smith. Our next panelist is Dr. Christopher Gillard. Dr. Gillard is a clinical associate professor at Xavier University College of Pharmacy. After earning a doctorate degree in pharmacy, he completed the pharmacy practice residency with Xavier and LSU Health Sciences Center. Dr. Gillard currently teaches topics in cardiovascular disease management in the College of Pharmacy. Dr. Gillard is a board certified pharmacotherapy specialist and maintains an internal medicine clinical pharmacy practice at UMC. Dr. Gillard is part of a research team that recently received NIH federal funding with goals to understand vaccine hesitancy among the African American population and potentially can improve vaccine uptake through community partnerships in the greater New Orleans area. Please join me in welcoming Dr. Christopher Gillard. Our third panelist is Dr. Eboni Price-Haywood. Dr. Price-Haywood is a general internal medicine specialist at Oschner Health, an associate professor of medicine at the University of Queensland Oschner Clinical School, and medical director for the Oschner Xavier Institute for Health Equity and Research. In partnership with Xavier University of Louisiana, the Institute uses outcomes research, population health, workforce development, health equity education initiatives, community engagement, and health advocacy to investigate and create solutions for the challenges that we face today. Dr. Price-Haywood recently achieved national and international recognition for her New England Journal of Medicine publication entitled Hospitalization and Mortality Among Black Patients and White Patients with COVID-19. She and the Institute's leadership are now leading efforts to promote equitable distribution of COVID-19 vaccines to populations disproportionately impacted by the virus. Over the last 20 years, her research in healthcare administrative work has focused on strategies to improve health equity for vulnerable populations and translating research into practice. She received her medical degree from Johns Hopkins University School of Medicine and a Master's of Public Health from Johns Hopkins Bloomberg School of Public Health. Please give a warm welcome to Dr. Price-Haywood. Joining us from Student Affairs is Nikki Dingle. Nikki is our Assistant Director of Recruitment and Outreach. She will be providing technical support and will be sharing some of her experiences with the COVID-19 vaccine. We also have with us today Mr. Brian Rosenthal. Brian is the Health Services Coordinator here at Delgado Community College and has been working with college leadership on COVID-19 related issues since the beginning of the pandemic. Let's begin this afternoon with an update of where we are with the COVID-19 and its vaccine from Dr. Rebecca Harris-Smith.
Good afternoon. Thanks for inviting me. And again, I'm enjoying my time at Delgado Community College as the health coordinator addressing healthcare issues. Just want to give you a quick run through of where we came from and where we are. COVID-19 was first seen in Wuhan, China in December of 2009. It was called SARS, as severe acute respiratory syndrome coronavirus 2. The virus was believed to be spread by droplets and coughing. In February of 2020, it was declared a public health emergency. By March 2020, the World Health Organization declared it a pandemic, and they banned travel internationally and locally. Again, it's believed to be spread by coughing, droplets, and close contact. We then moved to March of 2020, where they began clinical trials were in process, and they began recommendations for stay-at-home was ordered. By April, the National Institution of Health believed that we were showing some promise in making progress. By May of 20, with COVID testing, we identified that there were 100,000 COVID testing was begun, and by that time we had 100,000 deaths that had occurred. By June of 2020, vaccines were stated that they were going to be free to anyone once they were developed. July, there were 3 million infections. By this time, Moderna's vaccine was available and Pfizer was close behind. In July of 2020, the vaccine trials again began, and because we got the emergency use authorization. By August, they made sure that risks were identified for taking the vaccine. We continued with mask mandates, and we again we recommended increased testing. They also identified that by this time, COVID was the 3rd leading cause of death. And at that time, they also discovered that reinfection was possible. In September of 2020, the CDC reported COVID spread they also recognized that it could be spread in restaurants and different places like that. And J&J began their trials at that time. And by then we had 100 million rapid testing available. By October, we had 400 million people infected with COVID. By October, I said that already, November, 100,000 cases of COVID. We identified 100,000 cases of COVID in one day. So we can see how fast this was going, and the reason it was considered a pandemic and the need to do something. The EUA for Moderna and Pfizer was finally listed, with Moderna having a 94.5% efficacy and Pfizer having a 95% efficacy. By the time President Biden came in January of 2021, he promised that we would have 200 million doses of the vaccine in arms in his first 100 days, and he delivered. Again, so here we are at that point where we're able to slow down this disease as long as we can get vaccines in arms. And President Biden is predicting that the nation will be back on track by July 4th of 2021, provided we can get everyone vaccinated. That's my quick spin of where we were and where we are. Thank you.
Thank you, Dr. Harris-Smith, for that overview. Now let's get into some questions submitted to us by some of our faculty, staff, and students. So, question number 1. I've gotten one vaccine already. Do I really need to have that second shot?
So I'll go ahead and take this question, Dr. Duplessis. So yes, absolutely, a person does need to continue that and complete that vaccine series. A person does have to get that second shot and finish the vaccine series out. If it has been less than 2 weeks since your shot, or if you still need to get your second shot, you're not fully protected. As Dr. Harris-Smith spoke about the efficacy of the COVID vaccines being 94%, 95% effective, that was with the full vaccine series completed, the first dose and the second dose. It typically takes about 2 weeks after vaccination for the body to build protection against the virus that causes COVID-19. And a person is not fully vaccinated until 2 weeks after that second dose of the 2-dose vaccine series. So anyone that's receiving the Pfizer Moderna vaccine that requires the 2-dose series must complete that vaccine series out to get the full protection of 94% or higher protection against the COVID-19 virus.
Thank you for that explanation. I appreciate it. Next question. Do I have to take both shots at the same place?
Hi, I can address that. It is highly recommended that you take the vaccine at the same place. Louisiana has a program called Links where we introduce all of your information according to your vaccine, and you need to make sure that you're taking the same vaccine. So again, it is definitely highly recommended that you do, but if you've taken it one place where Oschner is giving it at one place and then you decide it's being offered somewhere else, it's feasible that you can do that, but it's highly recommended that you take the vaccine at the same place.
Thanks for that clarification. Here's our next question. What is the difference between the 3 vaccines?
I'll take that question. And so, the question is, how do these vaccines work? The Pfizer and the Moderna vaccines are what we call mRNA or messenger RNA. The Johnson & Johnson is a viral vector. It's an inactivated virus. One thing to be clear is that none of these vaccines contain a live virus. You cannot get the virus from the vaccine. The messenger RNA and the viral vector, the way they work is they create a protein called a spike protein that's found on the surface of the virus. Once the protein is created, it triggers the immune system to produce antibodies, which destroy the spike protein. The immune system then learns how to recognize and fight against the virus by recognizing that protein. The way it works is it prevents you from getting sick. So the other thing when we talk about the efficacy, the question is, what are we trying to do with the vaccines? And the primary purpose is to keep you from having symptomatic illness. However, we also know that these vaccines have been effective for reducing the risk of severe illness that would require hospitalization or even put you at risk for death. So that's why it's important to take these vaccines and how we measure the effectiveness and efficacy of the vaccines.
Thank you for providing that insight. Here's our next question. Why should I feel comfortable taking the Johnson & Johnson vaccine?
I'll take that. There was a halt when Johnson & Johnson, there were blood clots that was believed to be connected to the Johnson & Johnson vaccine. So a halt was placed on this medication to do further studies to determine whether or not this was actually a fact. Out of the millions of doses that were given, there was initially 6 people that were identified, then they identified 12, and then there was also a person with a stroke. They're trying to determine if this is particular to women. It was actually a gentleman that had the stroke. But I would caution you, students, all medications you take, go back and look at any of the medications you take. There's something called side effects and adverse reactions. And when something happens with a medication, there has to be some study, some further look to see if there is something that predisposes you to have what they call an adverse reaction. So yes, at this point, when you look at the statistics in the terms of how many people have actually taken, it hasn't been determined yet if there is any predispositions that would expose you to a blood clot, but that is being studied. So again, at this point, just look at that information, give it some time and let them continue to do the research.
Similarly, the next question we have is what happened with the J&J vaccine that made the CDC pause the use of it?
Sure, I can take that question. And as we recall, starting back from the original timeline, so the Johnson & Johnson vaccine was first received emergency use authorization in February 2021. Since it was approved in February, a total of about 7 million doses of the vaccine was administered. Earlier this month, as we all know, the vaccine was put on pause. This was recommended after reports of a rare type of blood clot in individuals that received the Johnson & Johnson vaccine. It was primarily in females in the age of the 30s and maybe the 40s, less than middle age. They paused the vaccine out of an abundance of caution for medical scientists to review the cases and current information. So that review was conducted, and the evidence suggests that the chance of this happening is extremely rare. As a reminder, there's about 12 to 15 cases of the rare blood clot out of 7 million doses of the vaccine. It was concluded it was extremely rare, and it was concluded that the potential benefits of the vaccine outweigh the risk. So that's why it was decided to halt the pause, and the vaccine is currently available as of today. The FDA and CDC are still closely monitoring the safety of the Johnson & Johnson vaccine, and also currently monitoring all available COVID-19 vaccines. So there was a pause that included a review of all the cases, and it was decided the benefits outweigh the risks regarding the Johnson & Johnson vaccine. So it's now, the pause has been revoked.
Excellent, that's good to know. Our next question, what are some of the side effects that we should be aware of?
So I guess I'll jump in and take this. Some of the side effects that we are seeing off of the COVID vaccine are just soreness around the muscle and the injection site. We're seeing a lot of fatigue, some fever, and some chills. We're seeing, which is common in most vaccines, you get like a small little piece of it for your body to fight that off. So that's your body fighting off the little bit of the vaccine that's been given to you.
And related, what are some of the side effects that we should be aware of?
I think we just covered.
I'm sorry, we covered that one. The serious reactions that will require medical attention.
All right, so and this kind of speaks to something that Dr. Harris mentioned earlier, side effects versus adverse effects. With side effects, we kind of know that they're going to happen. And I'll use a very common drug that I'm sure a lot of us have taken. I'll use Benadryl. We take that when we have some kind of allergic reaction. What Benadryl do is it'll force your body to release histamines to fight off the infection. The side effect of that is that it's going to make you sleepy and drowsy. We know that that's coming. That's very common. It's a little predictable there. What an adverse effect is something that we don't foresee happening. Like with the Johnson & Johnson shot, we saw a couple of people develop blood clots as far as that goes. Some adverse side effects, or the adverse effects, excuse me, that you need to really be concerned about is anytime your breathing becomes effective, like if you're laboring to breathe or you just struggle to catch your breath, that's something that you would need to contact your healthcare provider about. Any kind of chest pain, if it causes anything like that, any kind of also allergic reaction, if you break out in hives or anything like that, usually we'll kind of taper it off. If it's not the vaccine, they'll taper that off to try to figure out what's going on and fix all of that.
And may I add, Dr. Duplessis, also when a person receives the COVID vaccine, they are being asked to be monitored for at least 15 to 30 minutes as per recommendations by the CDC. So in amongst the healthcare professional to monitor if there are any immediate reactions to the vaccine. And also when we talk about the vaccine itself, it's important to talk about a response to the vaccine, a typical response to the vaccine. So sore arms or maybe headache or feeling fatigued are just traditional responses to the vaccination. That's actually a sign that your body's building up a protective response against COVID. So it's important to note those are things that are expected by the vaccine versus the things that Mr. Rosenthal talked about with shortness of breath or anaphylaxis, or things that are more serious adverse reactions.
Great. Since we're on the topic of the vaccine, here's our next question. What are some of your experiences with the vaccine?
So I'll speak to that one. I recently just got my second dose last week. So my first, I got the Moderna vaccine. That was the one that was available on the day that I went. After the first dose, I pretty much felt fine that day. I had a little soreness around my arm. And then really it was more the next day. I felt a lot of soreness kind of around that spot. And it was just, had to sort of stretch out, and it was a little bit hard to move my arm. But that was all I had as far as the first dose. And then the second dose, I kind of got those other side effects, right? I had soreness around the arm a little bit later that day. And then the next morning when I woke up, I was really like, I was like sweating, but I was having chills and I was just feeling sort of drained. But within 24 hours or less than that, I was pretty much completely back to feeling fine. So I sort of just spent the day on the couch, just sort of riding it out, just chilling and letting it sort of take its course. And then by the next day, I was perfectly fine and back to like 100% essentially.
Thank you, Nikki, for sharing your experiences with us. Here's our next question. Why are we taking the shot if we still have to wear masks?
I'll take that question, but I also want to follow up on common experiences with the vaccine. Everyone's reaction is different and it's not really predictable. In fact, I actually had no reaction to the vaccine, so it's very different. So I think it's important to talk to different people who have had the vaccine to see what their experiences are, and what you'll see, there's a huge scope of experiences from nothing to some of the symptoms that we just heard previously. In terms of why are we taking the shot if we still have to wear the mask, I'm going to answer two parts of that. First of which is hot off the press. The CDC just released guidelines for fully vaccinated versus people who are not fully vaccinated. If you are fully vaccinated, which again means that you're beyond the 2 weeks of the second dose, if you got Moderna or Pfizer, or 2 weeks after the Johnson & Johnson, that's when you're considered fully vaccinated. Those individuals, it is okay for them to be outside activities without the mask. The only caveat to that is not if you're in a heavily populated area. So in other words, if you go into the Crawfish Fest or any of these other festivals where there are a lot of people right next to each other, that's not considered safe outdoor activity. But if you're going to someone's house and going to the backyard and everyone's, outside, that's fine. When you go inside, however, they're recommending that in certain circumstances, you still must keep the mask on. So if you're in a public place, again, where there's a lot of people, you should have your mask on. If you're in a place where people are singing, church, you should have your mask on. So the CDC actually put out a poster that gives you a color coded of red, yellow, green, so that you know what circumstances, depending on your vaccination status, are permissible. If you have not been vaccinated, pretty much practically for almost everything, you should be wearing a mask and maintaining, regardless of whether or not outside or indoors. So again, fully vaccinated people have had some of the restrictions pulled back in terms of mask wearing. The other thing is to be aware of, we are still in the midst of learning about the virus. We are currently under an emergency use authorization, not a full approval of the vaccine as the FDA typically does. It's still collecting information. Some of the things that we do not know that it's important to be aware of are the virus variants that are out there. So you've heard the UK, South Africa, South America. Now they're talking about the strain from India. So we are still studying to what degree the current vaccines are effective against those variants, but you probably also heard that those companies are working on a booster shot, right? Because it may not be fully effective. We're still studying. So if you have been vaccinated and you were exposed to one of these variants, we can't tell you with 100% certainty what your outcome will be. So until we have more information, we have to continue to follow the science And when you're in certain situations, even if you're vaccinated, you should have the mask on. The other thing that we don't know, but we're still studying, is how well does it protect people who have weakened immune systems? And then the other critical question is, how long does the vaccine work to protect people? All of these things are questions that are still open, that they're studying. These are ongoing studies following folks for up to 2 years. And so until we have the final answers, we are still recommending that in certain situations, you continue to wear the mask. For more information, if you go to the CDC website, like I said, it has a color-coded recommendations.
All extremely, extremely important points. Thank you. Let's see. Here's one. When are we going to be able to stop quarantining?
I'll take that one. Again, with the new information that's coming out, we all just heard that Governor Bell Edwards for Louisiana opened the state. We're here, some of us are here in New Orleans, and Mayor Cantrell decided to go in a different route. Here's what we need to understand. Until we reach herd immunity, which is roughly 75 to 80% of everyone being vaccinated, but we have to understand we need to be our brother's keeper. We are not just taking the vaccine for ourselves. We should be taking the vaccine for our brothers and sisters. We all have parents, we have children, we have cousins, we have relatives. And until we're ready to do what we need to do to not only protect ourselves, but protect others, again, we should continue to wear our mask and do our social distancing. As it relates to quarantining, those of you that are not vaccinated, if there's an exposure, it is still recommended that you quarantine. The difficulty we're going to face is now that the orders have been that we lift mask wearing, it's going to be difficult now to know about exposures, because no one walks around with a V on their forehead that says, I've literally been vaccinated. So if you're going to large activities and you're in areas and you're not wearing your mask and you know that you have not been vaccinated, please know that you're putting others at risk. So let's be our brother's keeper. Let's make sure we're doing our part. If you've not been vaccinated, please continue to wear your mask. Know that you will need to quarantine if in fact you've been exposed, which is going to be difficult to know. So all I can continue to say is let's be each other's keeper. Let's continue to wear our masks, do our social distancing, and make sure you're keeping everyone aware, if you're not vaccinated, that you're wearing your mask to protect yourself and others. Doc, I didn't know if either you or Dr. Price-Haywood or Dr. Gillard, if you all wanted to jump in on that, I'd appreciate it.
No, I agree with you. I think the most important thing about all of this is one statement that you said, which is, I am my brother's keeper. Everything that we're doing is not actually all about self. It's more so about the people around you and protecting your family and friends and others. It's about the social consciousness that we have for helping our community to stay well. And that herd immunity that you reference is incredibly important. And the way that works is the more people who are vaccinated, the less likely the virus is going to find the person who's not vaccinated. If it can't transmit from one person to the next, it's likely not to keep mutating. So getting vaccinated is like putting a block on the virus from getting around the community, and also blocking it from having the opportunity to keep mutating, and then we keep chasing behind the virus to try to make sure we have the right vaccine. All of that is important for us to get back to our previous world of normalcy. And so if we're tired of the current circumstances, I would say let's think about all of our family and friends and neighbors and think about what we're doing to keep them safe. And, I'll be honest with you, if you have or have not experienced someone getting sick and hospitalized with COVID-19 personally, find someone, I'm sure someone in your network has been affected by COVID-19. And you may want to just sit down with them and talk about their experience and what impact it has had on them. And I will tell you that to see people who are sick with COVID-19, who have the long-term consequences of COVID-19, who have lost someone with COVID-19, those individuals have a very powerful story to share with you that gives you a very different perspective of what it means by what we're doing is being each other's keeper. And I encourage you to talk to folks if you have not.
I echo that. The only thing I wanted to say in addition is that we have a unique opportunity to play our parts. Each and every one of us play a role in us returning back to normal. So sleeves up, let's all get the vaccine. So let's move on. Our next question is, explain how the vaccine was made so quickly. I can take this one if you guys don't mind. While it may seem that the vaccine was made rather quickly, the technology involved with all three vaccines has actually been around for a long time. The Johnson & Johnson vaccine, as Dr. Price-Haywood alluded to earlier, is based on a viral vector. Viral vectors were introduced back in, I believe, the 1970s, and it have been used in vaccines, most recently for Ebola, and are in studies against other serious infectious diseases such as the Zika virus, the flu, and HIV. Besides being used in vaccines, viral vectors have also been studied for gene therapy, to treat cancer, and for molecular biology research. The Pfizer and Moderna vaccine, however, uses mRNA technology. mRNA technology itself is not new, but mRNA vaccines are an actual new type of vaccine. Researchers have been studying and working with mRNA vaccines for decades. Recent interest has grown in these vaccines because they can be developed in the lab using easily, readily available materials. This means that the process can be standardized, scaled up, making vaccine development faster. Once the COVID-19 virus was sequenced, both Pfizer and Moderna was able to design an mRNA molecule that codes for that unique spike protein in the COVID-19 virus to be used in the vaccine. Okay, so here's our next question. I'm pregnant. Is it safe for me to get the vaccine?
Okay, I can take that one. The CDC recommends that pregnant females get vaccinated with the COVID vaccine. This decision should be made in concordance with the pregnant female's OBGYN. What we know so far is there has been no data linked to adverse effects to the pregnant mother and also the fetus from the COVID vaccine. And also I want to remind everyone, when we talk about the COVID vaccinations that have emergency use authorization, although they came about pretty quick, they all underwent very rigorous studies before they came out for emergency use authorization. So there were people that were studied that got the vaccine before it was actually approved for emergency use. In the studies, there were females in the studies that were asked not to get pregnant, but some actual females did get pregnant in the studies, and they continue to follow those pregnant females. In the studies, there has been no data linked to those ladies, those pregnant females, or any adverse effects to the babies, and they continue to follow. So there's no data linked to adverse effects to the mom or the baby. In addition to that, regarding fertility, I know that's been a concern amongst people as well. There is no current data indicating that the COVID vaccines will reduce fertility of females.
Thank you. Our next question. Why is there no vaccine currently available for children?
So I'll take that question. So the emergency use authorization is based on the age at which you can vaccine is based on who participated in the initial trials for which there's data to authorize use of the vaccine. So initially with Pfizer, it was age 16 and higher, with Moderna, 18 and higher. Pfizer has been conducting a study in the age group 12 to 15, and we're actually about to start an earlier trial from age 6 months to 11 at Oschner. So we have to follow the science, and they can only authorize vaccines for the age groups that were included in the original studies. They are collecting data on those individuals. As more younger and younger people in different phases of the trial get added into the study, we'll be able to collect more information on those individuals, find out if the profile of side effects and other things are similar in the younger groups. And then based on that, the safety and the efficacy of it in those different age groups, they can then make a decision once there's sufficient data, whether or not it's okay to start administering those vaccines to younger age groups. But we anticipate with the trials that are going on right now that we will eventually get there. The question is when, and we don't have the answer to that just yet.
More on that to come. Our next question. Am I going to be required to be vaccinated before coming to school in the summer or the fall? Not at this time. I'll take this one. The current vaccines have been authorized by the U.S. Food and Drug Administration, or the FDA, under the emergency use authorization. Vaccines that have not met full approval cannot be mandated or will not be mandated by the state of Louisiana. However, they are highly recommended. So as of right now, as a state institution, Delgado Community College is not mandating vaccines again, but they are highly, highly, highly recommended. Here's our next question. Should I share my vaccine card on social media?
Oh, I'd be happy to take this one. So I think it's important for everyone to understand how the internet actually works as far as social media is concerned. When you post something, the entire world can see that. And that includes people that may be trying to steal your identity. What's on that card is your name, your date of birth, when you were vaccinated, where you were vaccinated, all of these pieces of personal information that is readily available for everybody to see. And what we know about identity theft is that it's multiple pieces of the puzzle. And the more pieces of the puzzle that you put out there for the general public to see, the more likely it is for that information to fall into the wrong hands. Now, like, I understand that everybody wants to be, they want to do their part. They're proud to do their part. They're happy to brag that they've fought and got their vaccine against COVID, but just be smart about it. Don't share your card. There are plenty other ways that you can share. You can do your profile, get a little frame for your profile picture, things like that.
Thank you. Our next question. Is it safe to travel? I'll jump in and take this one. Make no mistake, COVID-19 has not gone away, although many of our restrictions are being loosened at both the state and local level. COVID-19, if you remember, is spread through close contact with another person. The type of transportation you use while you travel, the type of accommodations you stay in, and the activities that you do can increase your risk of getting and spreading COVID-19. So right now, the CDC is recommending that you delay travel until you are fully vaccinated. And even if you are fully vaccinated, please make sure you use safer travel options in doing your trip. Wear a mask both over your nose and your mouth. Avoid crowds. Stay at least 6 feet away from anyone who is not traveling with you, and wash your hands or use hand sanitizer with at least 60% alcohol. Along those lines, here is our next question. I've heard airlines are asking us to show proof of vaccinations prior to travel. Is this true?
What the information that I've gotten thus far, I've checked with airlines. And again, because this drug is an emergency use authorization drug, it cannot be mandated. So you cannot be mandated. The airlines want to make sure that people are tested prior to traveling. But the other thing you need to know as well is that there are certain governments, especially for domestic flights, but for international flight, there are governments that may require vaccines for citizens upon entering from foreign areas. So you just need to make sure, check with the airline that you're going to be traveling on to see what their requirements are. And again, when you return, you may also be required, if you have not been fully vaccinated, vaccinated, you may be required to quarantine again. But I would suggest that you check with the particular airline that you're traveling with to make sure their requirements.
Excellent, thank you. And our next question. Things are always changing. What are Delgado's protocols for students?
I'll jump in on this one. So as it currently stands right now, for any vaccinated individual, if you, after the 2 weeks of after your second dose, if you are exposed, we are not asking you to quarantine. In order to come on campus every day, you will need to fill out our pre-screening tool through our Delgado mobile app in order to obtain a health pass. Any students that test positive will have to isolate for 10 days, as well as meet some other requirements, such as being fever-free for 24 hours without the use of medicine. I just drew a blank. Your respiratory symptoms must be improving, and you must show no other signs of COVID-19. If you are exposed by a friend, family member, and you are not vaccinated, that quarantine period, this is where it gets a little bit tricky. You can either quarantine for 10 days, or it's a 7-day quarantine if you provide a negative test result that is taken no sooner than the 5th day after your exposure. Any symptoms, anything like that needs to be reported through my office, which can be emailed at healthservices@dcc.edu. If you have any questions as far as that goes, I'll happy to answer them.
Thanks, Brian. So those were all the questions that were submitted prior to the beginning of this session. Nikki, are there any questions that have been submitted via chat that we have not already addressed?
No, we have covered everything. There were no additional questions.
Excellent. Well, thank you all for your time and attention today. I want to close this session by urging all of you to do your part. Mask up, keep the distance, wash your hands, get vaccinated, stay informed. Are there any other parting comments from our panelists?
I'd like to jump in and say, as again, Delgado's All Things COVID consultant, I want to thank those of you all that have actually taken the vaccine. Tulane allowed us to have appointments. They actually set individual appointments, and we're still taking those appointments. For anyone that's interested, you can go to our website and go to Delgado Cares, sign up. We were also blessed to have Oschner to partner with Braveheart Foundation on yesterday, and we actually did an on-site vaccination clinic. We were blessed to have 131 participants to come and take the vaccine. So to you all, I say thank you. Again, if there's nothing you take from this webinar, I hope you walk away considering being your brother's keeper. Think about it. You don't want to bring it home to your kids. You don't want to bring it to grandma or your mother or your spouse. So please, Delgado, we are huge. We are a large college, and we're asking you to think about it, consider it, roll your sleeve up, take the vaccine. Everyone here on this panel has taken it, and we're still here to talk about it. So please do us all a favor, be your brother's keeper. Thank you.
I'll jump in and echo that really quick. We all want to get back in the fall, and we all want our events back. So there's a light at the end of the tunnel, and we're so close, but it's not going to happen without everybody doing their part.
And I'll chime in as well. I just want to encourage everyone that's listening to the panel to make, if you haven't been vaccinated and you're still debating on your decision, well, we want everyone to make a well-informed decision. So and part of making a well-informed decision is having the most accurate information. So the CDC has a very good website that talks about common questions you may have about the vaccine, I encourage people to look at that for resources and also to talk to a healthcare provider. So to make a well-informed decision is to have the most accurate information about vaccination.
And I, just want to echo what everyone else is saying. I don't want to be repetitive because I think everyone has covered it, but I am going to close out with being our brother's keeper. It is incredibly important from a public health perspective, from a medical perspective. And like I said, the risk of having an adverse event with the vaccine is much lower than the risk of having complications should you actually acquire the virus. The rates of chronic conditions in our community, in our city, in our state are incredibly high. That is why we had a disproportionate impact of this virus on Black and Brown communities. And until we're able to address those health disparities to get us at a place of being completely well, part of what we need to do to maintain our resilience and to maintain our strength is to take this opportunity to stay well. And that's what the vaccine is trying to do, is to help us to stay well so that we can start tackling those other health issues. And so I do encourage everyone to get the vaccine. And again, if you have questions about the vaccines, please talk to your provider or go to the CDC's website for the updated information.
Excellent. And with that, I would like to take some time again to say thank you to our esteemed panelists. Thank you to our student affairs personnel, and thank you to each and every one of you who've taken the time out to be with us today and soak up some of this information as it relates to COVID-19. Thank you all again, and be well.